Now with Dr. Darien taking a look at a new study that suggests that prevention and screening may have prevented an estimated 80% of cancer deaths here in the U.S. since 1975. This is good news.
Great news. Nearly 6 million deaths. So this is a new report from JAMA Oncology, a large medical journal that looks at the effects of screening and prevention. We always talk about it. Getting screened early is one of the best ways to prevent cancer. But just how much benefit does that provide? It showed that things like pap smears, for example, prevented, get this, 100% of cervical cancer, which is preventable deaths in terms of when you look at the cervical cancer cases that were averted through testing. Pap smears were really effective. Colonoscopies, we've talked about this on the show, more than 80% of preventable deaths associated with colonoscopies. Tobacco control, 98%. And again, this accounts to more than 6 million deaths that have been averted just simply because people are getting tested and screened.
You know, as many people have been saved, there's still, I feel like we all know someone who has passed away from cancer. What more can be done to help?
Yeah, you know, I think opening conversations about this is really important. Releasing the stigma and the shame and the fear about getting screened early, and then remembering the ages that you should start at. We talk about this a lot, but for example, pap smears and cervical cancer screening, when you're at 30, you should have those conversations to create a plan. When we talk about colon cancer, prostate cancer, breast cancer, those all should start around the age of 40 and earlier if you have a family history. And then we talk about this a lot. Many people do not realize this. Lung cancer screenings. A low-dose CAT scan can be really helpful and effective in screening for lung cancer, and you want to start that conversation at the age of 50.
And how can you get over that fear? Because a lot of people don't like to get tested because they don't want to know if they have something.
Yeah, you know, nothing, unfortunately, the way I think about it and the way I help educate patients is that bad things don't go away by themselves. And so you've got to get in there, you got to have the conversation. If you feel fearful, bring a friend.
All right, Doc, thank you.